Hi, I'm Rebecca Petrosino, a physical therapist at Physical Therapy and Sports Medicine Centers in Fairfield, Connecticut. And I wanted to talk to you today about physical therapy for the TMJ or temporomandibular joint. That's an area that people often don't think of when they think of physical therapy, but it is an area that can be very helpful to treat headaches, jaw pain from clenching, grinding, maybe a bite malalignment, or muscle spasms in the jaw from stress or anxiety. So today I'm just going to show you a little bit about what we do in physical therapy to treat that area. What I may do is ask the patient to open and close. And I look for whether or not the movement is symmetrical, if there's any popping, clicking, or pain with that movement. I'll also ask them to bite down and assess whether or not the muscles in their jaw are either tight, tender to touch, or cause pain when they do bite down. So next what I'm going to look at is your side-to-side movement of your jaw. So I'm going to have you shift side to side, and I'm going to look for symmetry and again popping, clicking, or pain. And next what I'm going to do is look at the tenderness in the muscles as well as how the joint is moving in a more relaxed position. It's more comfortable for the patient and I can really get a look at the symmetry of movement. So one of the things that we look at is opening and closing pattern. Go ahead and open. And I look to see if there is popping, clicking, and whether or not the joints are symmetrical on the left and the right. And I'll also look to see if there's an abnormal pattern of movement. There can sometimes be what we call a C curve, where the jaw deviates out of position and ends up back in neutral, or an S curve, where it's asymmetric throughout. You can also have the jaw deflect to one side or another. Go ahead and open. So if the jaw deflects to one side, that usually means that that is the side that has some restriction. Next what I'm going to do is mobilize the TMJ. So if I do find restriction on one side, what I'm going to do is place my thumb on your bottom teeth. So go ahead and open. And then let your jaw be nice and relaxed. And I have a grasp on the jaw, but she's comfortable and relaxed, and I'm palpating the joint here to see what's happening and giving a nice stabilization. And then I'm going to move that joint and assess the mobility there. We can decompress a joint that is tight or restricted, and if somebody has limited opening, I can mobilize that joint to facilitate a better movement pattern. So another thing that I can do to try to relax the muscles of the jaw, go ahead and relax your jaw, but teeth not touching, perfect, is I am feeling some of the muscles on the inside of the jaw as well as muscles on the outside of the jaw, and you can just do some soft tissue mobilization to release muscle tension and to treat the muscles that have tension from clenching, grinding. And sometimes patients have appliances that they wear at night, and that does not necessarily mean that they would not benefit from physical therapy. Sometimes people who have a night guard still tend to clench on the night guard. It protects their teeth by having the guard, but it doesn't prevent the muscle tension. So regardless of whether or not they're having splint therapy, they may still benefit from having physical therapy. So we can also address the temporalis muscle. In that case, we can do some soft tissue mobilization to the temporalis. You can do some myofascial stretching of the temporalis by engaging the mandible or the jaw and providing a gentle stretch. Alright, so next what we're going to demonstrate is dry needling of the masseter, and that is a muscle in the jaw that is commonly tight or can have muscle spasm with clenching and grinding. So you feel in the muscle for any tight bands in the muscle or trigger point in the muscle, and when you find an area that needs treated, you're going to insert the dry needle, and then you can release the trigger point. And there was a good twitch right there. And that's all there is to the masseter. You can also perform dry needling to the temporalis, which is a muscle that can be involved with clenching and grinding, but it can also be affected with headache conditions. And again, you're going to palpate in the temporalis muscle and find any taut bands or trigger points, areas of tenderness and tightness. And release any of those trigger points.
Oh my gosh.
Okay.
That felt good.